The first bill up today is Representative Knorr's House File 729. Representative Knorr, to your bill.
Thank you, Mr. Chair. Before I begin, I just wanted to address a major issue that some of you who have been following. The proposed cuts on Medicaid. That's a significant challenge for all of us and for the people that we represent. The proposal that was passed by the Republican congressional members that may end up moving forward will definitely cripple our state's budget and the programs that we support and the people who need the service the most. Those who are living in home care or nursing home, or those who are being served in a different capacity. Hundreds and thousands of Minnesotans may lose their coverage, and that is not acceptable to our standards. So members, we've got our work cut out for us. We need to advocate that Medicaid should be protected for those most vulnerable individuals with disabilities, the seniors, and the programs that we have been fighting for to keep people in their homes. So with that, I just wanted to present that. Mr. Chair, I'd like to move House File 729 to be laid over for possible inclusion.
Thank you, Representative Knorr. To your bill.
Mr. Chair, I do have an amendment.
Representative Knorr moves the A1 amendment.
The A1 amendment, Mr. Chair, will put the bill in a shape that I want, and also it tightens the grant program.
Okay, are there any questions, technical questions to the amendment? Seeing none, all those in favor of adoption of the A1 amendment signify by saying aye. Aye. Opposed, say nay. The A1 amendment is adopted. Representative Knorr.
Thank you, Mr. Chair. I just wanted to note that the home care program is different than the CFSS, or formerly known as PCA program. What it does, it provides care for individuals in their homes. It definitely saves resources for the state of Minnesota, whereby individuals who are cared in home are not cared in institutional settings. It also provides savings to the state, where the individuals who are providing that care for those who need are being served by individuals who are able to do that work within their home settings. Mr. Chair and members, this has been a discussion in several years. But we think it's time for us to address the home care program as a whole. And I just wanted to let my testifier walk through the bill, and I'll answer any questions that you may have.
All right, welcome to the committee. Please introduce yourself for the record and present your testimony.
Thank you, Chair and committee members. We do also have a testifier, Kathy Messerly, on Zoom, who I believe was going to present or testify first. If that was.
Okay.
Chair Schumacher, are you able to hear me okay?
We can hear you. Please introduce yourself for the record and present your testimony.
Very good. Thank you, Chair Schumacher and members of the committee. My name is Kathy Messerly, and I'm the Executive Director of the Minnesota Home Care Association. I'd just like to start by saying how grateful I am to have the option of joining you virtually. While I'd much prefer to be there in person with you, I appreciate this option as I recover at home. MHCA's members provide hands-on care to more than 30,000 older Minnesotans and individuals with disabilities in their homes. At MHCA, we are acutely aware of the rapidly growing number of Minnesotans who have had to turn to more extensive, intensive, and currently overly stressed facility-based care if they don't have access to home care services. We know that hospitals and long-term care settings are not the preferred option for most Minnesotans, and our state budget cannot afford to provide that more intensive level of care to all who need it. As Representative Moore just referred to, and as he stated, this bill contains 3 distinct proposals the legislature can advance to increase access to home health services. First of all, sections 1 through 7 establish a reimbursement rate for a limited annual number of required home care evaluation visits. 3 specific kinds of evaluations are required. They're more comprehensive and take 3 to 5 times as long as the typical home care visit, which is how they are reimbursed currently. The 3 visits are start of care visits, which is required at the start of any new episode of care to develop the service plan. Secondly, the recertification visits are required every 60 days to ensure everything is going well and make any needed modifications. And lastly, resumption of care. That's required if there's been an interruption in the plan of care, such as a patient getting admitted to a hospital for more than 24 hours. Expecting providers to cover the cost of the mandated evaluation visits adds to the challenge of meeting the needs of people in the community. Section 8 of the bill adjusts the medical assistance reimbursement rate for a specific set of home care services, such that the rates are a bit closer to the cost of providing care. These services include homemaker services under the disability and elderly waivers, home health agency services, which includes the home health aid, rehab therapy, and skilled nursing visit services, as well as the home care nursing services. This change will help providers to address staff wage and benefit challenges. Our providers around the state tell us time and again how the low medical assistance reimbursement rates make it extremely challenging to pay a sufficient wage to recruit and retain the home care staff. With the demographic trend of fewer people in the workforce, we must do all we can to offer strong wages and benefits to the individuals who do step forward to provide critical home care services. And finally, Section 9 of the bill establishes a one-time grant program focused on recruiting new home care staff. With the amendment language adopted into the bill, this grant program is now narrowly focused on compensation to home care nurses who agree to serve as a preceptor for nursing students. A critical part of the solution to our home care workforce shortage is to expose more younger and newer nurses to the home care career option. Better supporting our home care provider organizations to serve as a site for nursing student clinical rotations is a powerful way to do that. In closing, I want to thank the legislature for the significant investments you have made in home care services over the years. They were very appreciated. However, there still remains very real needs for addressing reimbursement rate for home care services and the impact that has on providing the needed care. We know legislators will be faced with a challenging budget situation in the coming years, but we look forward to partnering with you all this year and into the future to advance thoughtful and economically sound approaches aimed at addressing the underfunding of these services. I ask for your support of this bill, and I'm happy to take any questions after our second and final testifier.
Thank you, Ms. Miserly, for your testimony today. Ms. Baker.
Thank you, Chair and committee members. My name is Jen Baker. I'm the administrator with the Good Samaritan Society Home Healthcare located in Robbinsdale. Thank you for the opportunity today to testify in support of this bill. The Good Samaritan Society is a nonprofit organization providing skilled nursing, physical, occupational, and speech therapies, as well as other supportive services such as home health aides and social work. We strive to really improve the human condition at every stage of life through exceptional care, spiritual enrichment, and innovation and discovery. At Good Samaritan, we see every day the impact that home health care can make with the access to home care services on individuals and their families. One example that comes to mind recently was one of our own employees' 94-year-old grandmother. She came to Good Samaritan after suffering a fall and a long, drawn-out hospitalization stay. Following her hospital stay and some rehabilitation within a transitional care unit, her greatest wish was to heal at home in the comfort of her own bed and with her own support of her family. With the support of home care services through Good Samaritan Society, she regained her strength and independence, allowing her to remain safely in the place that she loved the most, which was her own home. I want to highlight this story because during her home health episode of care, she also suffered a urinary tract infection, which oftentimes patients go back to the emergency room in order to seek treatment and care, and can be very debilitating for our elderly seniors. This woman in particular was able to reach out to her home care nurse, to which we were able to intervene quickly and treat the urinary tract infection in her home and avoiding that hospitalization. However, we see every day situations that are unlike this individual due to the underfunding of various home care services and activities that impact Minnesotans who are in dire need of such services. For instance, home care agencies have for years absorbed the high cost of starting and resuming care for a client in the home. So as Kathy had already explained, those in-depth care evaluations, these can take up to 2 hours in the home alone, plus an additional 2 to 3 hours of documentation once back in the office or back at their own home to finish that paperwork. This is done to comply with state and federal standards of care. We're reimbursed for those visits no differently than a routine follow-up visit, which usually takes 1 hour of our time. It's very challenging to make this service work when the money is lost in these in-depth care evaluation visits. The proposal in this bill is to allow for separate care evaluation reimbursement, and that would be extremely helpful in a step forward in addressing the underfunding of this service cost. Additionally, while our organization works to have as robust wages as possible and benefits for our incredibly valuable staff, at the end of the day, we're limited by legislatively set medical assistance reimbursement rates that we receive. The individuals who show up for work day after day in these homes, in these caregiving roles, are truly some of the most valuable workers that we ever see. In the payment rates that we receive, it would be beneficial to better reflect the reality of the care that they truly deliver. In 2024, with the Good Samaritan Society at my location alone, we had what I know to be true is 325 potential referrals for home care services with a form of medical assistance that we could not provide home health services due to either staffing or reimbursement limitations. And those are just the folks that we know about within our agency. Lastly, we've seen a positive impact that comes when we're able to have nursing students come and do clinical rotations in home care services. So as we had talked about with the grant funding, individuals who hadn't considered going into this line of work, they don't get much exposure to it, and they don't know how invaluable and exceptional care we can provide in home care services. In fact, many nursing students are often kind of deterred from going into home care services right after graduating from a program, whether it be nursing or therapy services, just due to the lack of knowledge about the autonomy that it is in home care services. So they're often sidetracked to go different routes, such as hospitals or nursing homes. I believe that this grant would help to improve our workforce within home health care, and it would help to compensate and recognize those who step up to take on these precepting roles. So I ask for your support for this proposal to help more Minnesotans across the state get access to these critical supports that they need to remain living in their own homes. And I just want to say thank you again for allowing me this time to come today and speak on behalf of this bill. And of course, I'd be happy to answer any questions.
Thank you, Ms. Baker, for your testimony this morning. Is there anyone else who wishes to testify on House File 729? No one's making a move, so we'll close public testimony and open it up to member questions. Questions from members. Representative Momani Hiltsley.
Thank you, Chair. So as I was going through the bill, I just have two quick questions. So from your perspective, what matrix or criteria would you use to evaluate the success of the proposed changes?
Ms. Baker, Representative Knorr.
Thank you, Mr. Chair. I'll defer to Ms. Baker.
Ms. Baker.
Thank you. I would love to answer that question. I would need to reference some materials unless Kathy Messerly has anything to add to that, but I'd be happy to get back to you on the details of that.
Chair Schumacher and Representative,
Ms.
I could
Messerly.
certainly add just a little bit. Part of the success that we would see would be the decrease of Medicaid or medical assistance clients being turned away. As Ms. Baker referred to, we are turning a significant number away. And if we could be reimbursing agencies a bit more, they would be able to take more of the medical assistance clients in. So that would be probably the number one thing that I would point to. We don't have a good way to measure the number of nursing students who are going into home care, but we get anecdotal information from the colleges. And I can tell you that they have been begging for more clinical rotations in home care, and we just haven't been able to provide enough sites for them. I hope that's helpful.
Representative
Chair.
Momani Hiltzley.
Thank you, that was good. Thank you for that. And then I don't know if you wanted to say something?
No, go ahead.
Okay. My second question, Chair, thank you. I am wondering, what are the provisions to address disparities, especially between the service availability between urban and rural areas? Thank you.
Representative Knorr.
Thank you, Mr. Chair. I think addressing the disparities is significant. When it comes to Greater Minnesota, lack of qualified individuals, nurses, medical care providers is a huge impact on Greater Minnesota. And likewise, I think the grant program may become an incentive to attract, maintain, and retain the workforce that is necessary to provide home care services. It doesn't pay as good as hospitals, so there's more competitive recruitment when it comes to other institutions. So we want to make sure that they get competitive pay, and we can keep those workers in Greater Minnesota. If they're recruited to stay there, they will stay there. Likewise, I think one of the key other advantages to this program is it's going to address the complex transition where people are stuck in the hospitals. And with this program, it provides us an alternative whereby individuals will be said to be cared in their homes. So that's significant for all of us as we know about the hospital transition, or the number of people who are now stuck in the hospital, just waiting to be discharged.
Representative Momani Hiltzley.
Thank you so much, Chair. I just wanted to thank you for bringing this up because my district has a very large number of group homes, meaning that people are wanting to stay in their homes, and providing quality care for them is really critical. So thank you. Thank you, Chair.
Thank you. Any other questions for the testifiers or the bill author? Representative Keeler.
Thank you, Chair. Mine is about Section 9 as well with the grant programs. I have said it in other areas. I think it is really important that we invest in the future professionals that we have. My one question or consideration would be, nothing that I'm reading here identifies that there's a Greater Minnesota lane for this. And so I don't know who would answer the question, but in this grant process, how will we make sure that we've seen these maps that show these areas of lack of support? And when we ask about the resources, it tends to be the professional lane that we need. And so can somebody answer or talk about how we would make sure this grant money is utilized in Greater Minnesota, where we believe, or where we're learning, has a higher deficit in the professional bench?
Who would like that? Representative Knorr.
Thank you, Mr. Chair. With the A1 amendment, Section 9, if you look at subdivision 4, specifically points out the geographical location based on the enrollment and the services that are being provided. So it's going to be based on that geographical distribution. So the grants will be awarded based on that. So if there are less services in Greater Minnesota, that's a different conversational level. But with this one, I think it targets specifically different areas based on the need.
Representative Keeler.
Sounds good, thank you. The follow-up question to that is then, which colleges and nursing programs are we leaning into to make sure that they're getting their education from Greater Minnesota? That this isn't just, I guess, just answer the first question. What colleges are we partnering with in nursing programs?
Representative Knorr.
Thank you, Mr. Chair. I will defer that to my testifiers because I don't have specific colleges or institutions that have been identified in this bill.
Ms. Baker.
Chair Schumacher, I would be happy
Ms.
to address it.
Ms. Messerly.
Chair Schumacher and Representative Keeler, we have been working with a multitude of colleges. We tend to work with the organization so that it's statewide. So there's one organization that is for the 4-year programs, and there's another organization that's for the 2-year programs. So those colleges are around the state of Minnesota. I hope that's helpful.
Representative Keeler.
Yep, that's good, thank you.
Any other questions, Representative Keeler? Doesn't look like it. Representative Gordon.
Thank you, Mr. Chair, and Representative Knorr. I'm just curious what the cost increase will be when we start, if we were to start covering care evaluations. I mean, is there an estimate on what that added cost would be?
Representative Knorr.
Thank you, Mr. Chair. I think the previous estimate indicated it's about 5 million based on the previous bills that we presented, so that may need to be revised. I don't know if I can get help from the nonpartisan staff. Mr. Berg?
Mr. Berg.
Mr. Chair and members, there was, as Representative Knorr mentioned, there was a fiscal note on the first 7 sections of the bill in front of you in 2024, which had costs of about 2.3 million in 25 and 5.4 million in 26, and 5 million ongoing. There is a pending fiscal note request now, which for the new bill, those 7 sections could be scored, as it were. The last 2 sections will need some additional, there's a blank rate increase and there's a blank appropriation for the grant program. Those will not be able to be scored until there's some further information.
Representative Gordon.
Thank you, that's all I had.
Any further questions for House File 729? Seeing none, the committee thanks you for your testimony and presentation today, and House File 729 is laid over.